This segment is sponsored by Urology Austin. Well, September is Prostate Cancer Awareness Month, and today I'm at Urology Austin with Dr. Peter Ruff to discuss screening and treatment options. Good morning, Dr. Ruff.
Good morning.
How are you doing today?
I'm doing great.
All right, Dr. Ruff, finding prostate cancer early is really important. So talk to us about who should be screened and what's involved.
Prostate cancer screening is super important because we want to try and catch the cancer as early as possible, because that really affects your treatment options and allows you to get the best treatment with the highest cure rate and let you get on with your life going forward. The people that should be screened are most men over the age of 50. Especially important are African American men starting at age 45 and patients with a first-degree relative with prostate cancer at the same age. It's really simple to do. It's essentially just a blood test once a year as well as an exam from your doctor once a year. And prostate cancer screening is super important because of the prevalence of the cancer. It is the single most common type of cancer in men. About 350,000 people are diagnosed each year in the United States with prostate cancer. And of those, about 35,000 men will die from prostate cancer as well. So catching it as early as possible is that much more important.
All right, let's talk about the different treatment options for prostate cancer and what makes all of them different.
There are a lot of different treatment options for prostate cancer, fortunately. They all have their pros and cons, and it's really important you have a conversation with your doctor going over each one of those different options. They range from things like different types of radiation to surgery to some of the more minimally invasive treatment options. And when you're going through them all, you'll want to balance the efficacy of the treatment versus the potential side effects and how it affects your long-term quality of life.
All right, Dr. Ruff, I want to highlight you just a little bit. You're one of the first 15 surgeons in the world trained in the single port Da Vinci robot. And I want to know, how is that used for prostate surgery and what are the benefits?
There are a lot of different benefits, first of all. Robotic surgery has really developed over the course of the last 15 or 20 years. The most current rendition of that, if you will, is the single port Da Vinci robot, in which instead of having multiple incisions across your abdomen, you have one single incision that's about 1.5 inches in length through your belly button. This is great because it's really significantly reduced your recovery time. Most of these are done as an outpatient these days. People can get back to work within a week or two, which is really great for patients that want to get on with their lives.
And in closing, talk to us a little bit about Urology Austin, who you guys are and what you do.
Urology Austin is a large, fully integrated urology practice that serves all the different subspecialties within urology, including the different types of cancers. And so that's a great benefit for our patients because we can give all the different perspectives on all the different subtypes of treatment for prostate cancer, which allows better service for our patients.
Dr. Ruff, thank you so much. I really appreciate your time and all the information today.
Thank you all so much.
To learn more about prostate cancer screening and surgery options, including the Da Vinci robot, you can find Urology Austin at any of their 18 locations across Central Texas. Visit urologyaustin.com to find the one near you. This segment is sponsored by Urology Austin.